Next, Kathy says that she's 7 weeks after her new knee replacement. She notices a clicking and popping with every step. She says she notices that her knee is still fairly tight, and she wonders whether or not these symptoms or signs will go away with time. So I want to try and dissect those a little bit. So number one, with the stiffness. So we talked a little bit about with the first question that I answered about the stiffness, and that can be normal, for up to 12 weeks plus after surgery. And there is definitely a difference between a restricted range of motion and a sensation of stiffness. So if you have good range of motion, but the knee feels stiff to you, that will likely get better over time. If you have a really restricted range of motion, that's something that you should, and you're at 7 weeks from surgery, is probably something that you should talk to your surgeon about if they're not aware of it. And the clicking and popping with every step. So your knee before surgery did click and pop. The issue or the difference is that you had a little bit of cartilage and a little bit of bone, and those things don't make much noise. Now you've got a knee replacement that has, that are metal and plastic parts, and they do make a little bit of noise. Now that noise tends to dissipate with time because of the scar tissue that forms around the knee, and it sort of quiets it down, for lack of a better way to describe it. Now, you can't, depending on the type of knee replacement that you have, there's a couple of specific designs of knee replacement that do have a characteristic popping, and it's a syndrome called patellar clunk or kneecap clunk. And that often does settle down with time. However, in certain situations, that does persist and can require surgery down the line. Now, hopefully that is not you. I can't really comment whether or not that's you specifically, but if that popping or that clicking with every step does persist for a greater than a period of about 12 weeks, it's something that your surgeon should know about, and they can often offer a few other options. In addition to that, especially at 7 weeks, your thigh muscle, your quadricep function, has not fully returned after knee replacement. And really it takes about 10 to 12 weeks for that thigh muscle to fully strengthen back up. And often once that thigh muscle is strengthened back up, that clicking and popping almost goes away completely. So my thought is that it probably will. However, if it does continue, Kathy, then you should speak to your surgeon about it, okay?